Well, hello, Vardians, and welcome back to another episode of Healthcare Boulevard. This is a podcast where we explore all career options under the healthcare umbrella. We do this by interviewing professionals in each healthcare field. Within the last 2 seasons, we have covered social workers, speech therapists, acupuncturists, physical therapists, and the list goes on. My name is Sena Kako Moore. I am a physician associate, the creator and host of Healthcare Boulevard. Please tune in on Apple Podcast, Spotify, or your preferred streaming app. Without further ado, let's get into today's interview. All right, audience, welcome back to our first interview of 2023. I am very excited to have Angel on the show. Welcome, Angel. How you doing?
I'm doing so well. How are you doing today?
I am well, thank you. We are both burning the midnight oil, as folks say,
Yes, that is what they say. Yes, it is.
on a Sunday evening when we both know we should be sleeping, but we're out here doing it for the profession.
Exactly. That's right. That's right.
Welcome to the show, Angel, and tell us a little bit about yourself.
Okay, well, good evening, good morning, good afternoon from wherever you all are. My name is Angel Iwuoma. I am a registered nurse in the state of California. I enjoy my free time, and in that time when I'm not working as a nurse, I love to dance. I love to cook and cater. I love to watch reality TV to de-stress. And also I am an adjunct faculty member for incoming nursing students. So I essentially will begin to precept incoming nursing students. So that's just a little snapshot of who I am.
Okay, so nursing, as I was telling you before we hit recording, is one of the oldest healthcare professions out there. There is no denying that. In being the case, there are different titles that's under the nursing umbrella. Which one of those titles do you hold, and what was your journey there?
Yeah, so I heard I hold the title of registered nurse. So my journey there was you can get through this route. So my official titles are like Masters of Science in Nursing Education. Then I got my Bachelor's of Science in Nursing. So for to begin, my Bachelor's of Science in Nursing, it was a 4-year program. And then I obtained my BSN. And then about let's say 6 months after I finished my bachelor's, I knew I always wanted to teach. So I just said, let me go for my master's in nursing education. And it was a 2-year program, but I was able to complete it in 1.5 years. So that was my journey. So my official title is a registered nurse, but I do have a master's of science in nursing, and I also have my bachelor's of science in nursing.
Okay. So the bachelor's in nursing is what gave you the clinical RN title, is that correct? Or which, because I know
Um,
there's also like the master way to get to RN. So I'm trying to
yeah,
dive in a
yeah.
little deep.
Yeah, it is a little like I know it can get a little confusing. So there are
Yes.
you can obtain the registered nurse title without having your bachelor's, right? So you can go through the associate's way, so like go
Mm-hmm.
through like a community college, and as long as you pass the NCLEX, which is the nursing licensure exam, you are able to become a registered nurse. However, a lot of nurses nowadays are starting to get their bachelor's of science in nursing because a lot of hospitals require that, especially magnet hospitals. And I know in some time they're really going to want nurses to continue to like progress like in their level of education and things like
Mm-hmm.
that. So you can be a registered nurse without your bachelor's of science, and it is a different route. Now you can also become a registered nurse by getting your master's of science in nursing, but that's kind of typically an accelerated program, and that's typically for people who already have a bachelor's degree in something else. So you can have your bachelor's degree in something else, and you can enroll like in a master's program. That's typically when you have a previous degree, and then that's typically like a 2-year or like 1.5 year program, accelerated, and
Mm-hmm.
then you can get um your registered nurse license so long as you take the NCLEX. Confusing,
Mm-hmm.
but there's a few routes, which is good. Yeah.
Yes, yes. So the associate way, interestingly, is how my sister got her
Yeah, okay.
And then my brother did his with the BSN.
Okay.
I had some of my PA friends whose family members are currently working on their masters, which will get them the ability to get, sit for the NCLEX and then earn
Yes,
the RN. So it's so many different ways you can get to that RN, title, so to speak, as long to it qualify you to sit down for the NCLEX, which is
correct.
very interesting. And I like that because it allows you to get there without having to restart over. If say you
Exactly.
have a
Yeah.
bachelor's
Yeah.
degree in
Mhm.
something else, and you're like, oh, now I want to become a nurse. You don't have to go ahead and get another bachelor's degree, unless you want to. It's so many different options. Now, tell us about your setting as far as where you're working.
Yeah, so I've worked in a few different settings, but my main specialty setting is medical surgical, as well as telemetry and as well as PCU or progressive care unit. So there's kind of like, I'll just put it simply, like kind of when you get admitted to a hospital, there's certain like levels in terms of like criticalness, for lack of a better term. So like
Mm-hmm.
kind of if you're like more stable, you're on a medical surgical floor, that's like a general. If you kind of need some type of like heart monitoring, which is like telemetry monitoring, you would be med surg telemetry. And
Mm-hmm.
then if you kind of need a bit more intermediate care, there is progressive care unit, also called like some places call step down, some places call intermediate, and then there's the ICU, which is the most critical. So I've
Mm-hmm.
done medical surgical, kind of the stable. I've done medical surgical telemetry, patients kind of stable with kind of heart situations that need monitoring. And I've also done progressive care unit. And each of these different like levels of critical of care rather, they have different ratios. So like medical
Mm-hmm.
surgical, one nurse to five patients, medical surgical telemetry, one nurse to four patients, progressive care unit is one nurse to three patients, and then like
Mm-hmm.
ICU, depending on how critical, it's either one nurse to one patient or one nurse to two patients. Some states
Mm-hmm.
do differently, but so I work on a medical surgical telemetry floor with also I have some progressive care unit training as well. So medical surgical telemetry is where I am right now.
Okay. Have you always worked in the hospital since you started working as as an RN?
Oh, almost. Almost. Yeah, so I actually I forgot to mention, yeah, before I started working on a medical surgical floor, I was actually a psychiatric nurse. So I
Oh,
did psych
wow.
nursing for like 6 months. I was so excited to get my degree and like start working that I actually started working as a nurse before I was licensed as an RN because they have I forgot what the exact term is, but it's like a conditional license, like a little bit, like maybe a month before you take your NCLEX. It's like as long as you plan to pass the NCLEX or so that you can work. So it's like
Mm-hmm.
a thing that the board can give you. So yeah,
Okay.
I was a psych nurse for 6 months. So that was like a small inpatient facility. It was still called a hospital, but it was only like 60 beds.
Okay.
The
Okay.
hospitals that I've worked at have been like anywhere from 500 to 1,000 beds. So it was like a really small psych hospital. So I
Mm-hmm.
technically have always worked in the hospital setting.
Like
Yeah.
inpatient. Mm-hmm.
Inpatient. Yeah.
How was that being a psych med? It's okay. So here's the thing: psych, psych as a profession, as a specialty, right?
Yeah.
Whether it's for nursing, PA, it's just one of those specialties that either you love it or you stay away from it, right? So how was your experience there, and why did you leave?
Yeah. So for me, I did enjoy it. I did
Mm-hmm.
actually enjoy it. Just the facility was 75 miles from my house. So it was quite far. And then also I got like an opportunity at like kind of like one of the best hospitals in the nation, like that's
Gotcha.
me as a new graduate nurse, to enter a new graduate program to hone and like tame my skills. So I wanted to take that opportunity. But in
Okay.
the psych facility, I did enjoy it. I did enjoy it. There were obviously moments where, um, like sometimes you're like, you kind of, well, at least for me rather, I kind of,
Mm-hmm.
I don't say like embodied their diagnosis. That's not what I'm saying, but it was more sometimes I
Mm-hmm.
would think like, am I like depressed? Am I anxious? Like I would, I would kind of, I don't
Oh,
know. Yeah.
I know what you mean. Like you probably had this like when you were in nursing school, and it happened to me too while I was in PA school, where you learn about the fact, the
Yes.
diagnosis, the pathology, and you're studying,
Yep.
whether it's derm, and you started looking at your skin like, let's see,
Yeah.
maybe this
Yeah.
this basal cell carcinoma.
Exactly.
I
Exactly.
know what you mean. Or like you have like little gurgling of your stomach. I'm like, I wonder what this is. It's my pancreas.
Yeah, yeah, exactly. So I think everyone kind of has that situation, when they go into the health. I think, being a healthcare
Yeah.
professional, like once you kind of know like a good amount of information about things, you start to like, like overly assess everything and think like, do
Mm-hmm.
I have this? Do I have that? Yeah. So I think that's
Yeah.
what's going on. But for the most
Yeah.
part, I was one of those people who say they absolutely do not like it. I know people who are like, I would never do psych. No, 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 no. Like for me,
Mm-hmm.
I would go back. I
Yeah.
would,
Okay.
yeah.
Okay. But I'm sure that was even more strange being in psych because in terms of derm or GI, we can cross things out and be like, okay, you don't have pancreatitis, you don't have this. But with psych, it's easier to sort of put yourself in that situation
Yes.
because
Yes. Yes.
a lot of us are like functioning psych patients.
Yeah. Right. Let's just be honest, right?
Let's be honest, psych patients.
Yeah,
Nobody has diagnosis yet. We're just running away from the diagnosis.
exactly. Mhm.
Yeah, so I can imagine what that would be like.
Yeah.
Um, but it's nursing again. Such a common term. But tell us in the capacity of an RN, how would you describe an RN to somebody who hasn't heard of the profession for some reason?
Yes, yes.
Somebody walking on the street, or a young person who wants to learn, who wants to become a nurse one day, possibly, how would you describe your profession to them?
So, in simple terms, I would say that I am a licensed professional through I know that's kind of sounds a little intricate, but a licensed professional through the Board of Nursing
Mm-hmm.
um, that provides aids and coordinates patient care. I provide patient education. I essentially like I'm a part of an interdisciplinary team. So I work with a physician, um, with physician assistants, with nurse practitioners, with dietitians, with
Mm-hmm.
physical therapists to essentially create a plan and coordinate this patient care. And the end goal is to, ultimately have the patient like have a safe discharge like in the end. So just kind of
Mm-hmm.
coordinating patient care, and I'm essentially at the bedside with them throughout their stay in the hospital. So I'm the main one that they see throughout their stay in the hospital. Of course the doctors and everybody comes in, but I'm with them. Typically nurse shifts are 12 hours a day,
Mm-hmm.
12 to well 12-hour shifts, so they'll have two nurses a day typically, unless it's like an 8-hour facility. But so I'm essentially with them through that time. So I give their medication, I ambulate with the patient, I update the doctor, the also like physician assistant, nurse practitioner, anyone who's under the care about the patient's progressive status. Again, coordinate care. I would admit the patient from the nurse side. I would discharge the
Mm-hmm.
patient from the nurse side. So I really am there, like aiding and planning and coordinating their patient care while they're in the hospital.
Mm-hmm.
So,
Mm-hmm. There's been a lot of, I would say, some hearsay and sometimes some misconception about the nurse provider relationship, right? And of course, it will be different for each nurse provider. Like whomever doctors or PAs or nurse practitioners you work with now, your relationship with them and how you work with them to help a patient is likely to be different if it was different providers, right? So how is that? What would you say is essential to have, right? As from your side as a nurse, to have a great nurse provider relationship that essentially is the best, gives the patient the best outcome.
yeah, so I would say I know it sounds cliche, but communication, like
Yeah, yeah.
that's like number one. Like number
Mhm.
one, like if a patient status changes make sure to let the provider know. Also, providers have specific orders that say if the patient has X, Y, and Z, please like notify provider of this. Also, what's really good is to make sure that this is one thing, documenting the patient's intake and output. Some providers are more specific about that, but a lot of providers, like, they sometimes keep patients like in the hospital because they think that they haven't like eaten anything. They think that they haven't had like any urine output. So it's important also for, like, the like nurses, for example, to provide that information. And I would say to notify the physician of any changes as soon as possible, so that way they
Mm-hmm.
can provide the best care. You don't want to delay care and then cause patient harm.
Mm-hmm.
The
Mm-hmm.
main thing is communication. Like today, I was overhearing there was a provider and a nurse at the station. I guess it was an issue. The nurse was there the day prior, and they were like a colorectal patient or something. And then they're really specific about like their intake and output and all this stuff like that. And I guess there was nothing charted. And the provider was just like, you know what, like I would like us to have a great relationship here. And like I put specific orders, like, but the nurse was like, oh no, like I thought that I charted something, but I forgot to chart it. So it was a thing about
Mm-hmm.
communication, and it's where
Mm-hmm.
the provider stated, hey, like, can you do these things for me? And the nurse may have thought that they did it, but they did not. So it's something whereby there needs to be like open loop communication.
Mm-hmm. Mm-hmm.
Like everyone should, kind of do their part to provide the best patient care. So I would say communication and
It's
at
key.
home is key. Yeah.
Yeah, that makes total sense. And on the other end, I know nurses in the hospital, but some hospitals, maybe not all, but some hospitals definitely have LVNs, right? I know you're not an LVN, but does your hospital have LVNs in your hospital? Hmm.
So at the facility, they do have LVNs. This is my first time working with LVNs. My other
Okay,
2 and something years of being a nurse, I've never worked with LVNs. So,
gotcha.
but yeah, we do.
Mm-hmm.
Sometimes depending on staffing. And if I do, like I'm essentially in charge of like the LVN's patient. Like I have to sign off on their charting, and they're
Mm-hmm.
able to essentially pretty much they can do main things, but they cannot like admit a patient, they cannot discharge a patient, they cannot give any IV medication for
Mm-hmm.
patients. And then also like when if it's like a thing where we're endorsing care, like I would have to give report on behalf of them. Like that's at my facility at least. I don't know how other
Mm-hmm.
places, but
Right.
the main thing, they're not allowed to do like oral medications. And like if there's like a change in like a patient status and things like that that causes the need for like a reassessment, then the registered nurse has to do that.
How to do that. Okay. All right.
Yep.
That's good to know. And what is some of your favorite part of your profession?
I would say just kind of being there for patients at their most vulnerable time. Like I think when
Mm-hmm.
people get to the hospital, like no one's excited. Like, yeah, I'm in the like nobody, I've never met anybody that's been excited to go to the hospital. I don't think any of us would.
Not even us healthkare
Oh
providers
yeah.
or healthcare workers. Like, no.
Yeah, it's really,
I
yeah.
showed up to my patient. I'm like, listen, we are like, if I'm seeing a patient who we was following up closely, and I'm oncology,
I know,
oncology
right?
hematology. So like we were following them every 3 months or so, and like, everything looks stable for a few follow-ups. And like, we can stretch it to 4 months. I'm like, they're like, oh, no argument here at all. Like, I don't want to come here.
Yeah, right. Yep, yep.
Yeah, yeah, yeah.
Yeah.
Yeah. But no, go on. I didn't mean
No, that's true. No, you're very right. I
Yeah,
agree.
yeah,
Yeah, no one
yeah.
would be there. So I think like my favorite part is providing that compassionate care. Like I think oftentimes like, I think it's I don't know, for me it's just like a blessing to be able to care again for someone in that time. Like I think you're like
Hmm.
the first one of like their, especially as a nurse, you're really by their side. So if you come with this like positive, caring attitude, it really eases their
Anxiety.
stress level
Yeah.
anxiety, stress level anxiety.
Hmm.
It makes them feel good. And like I remember like even today, like I had a patient, she didn't really speak much English, but we were able to still communicate with Spanish. But she was
Hmm.
I love you. Like, and I was like, just
Oh,
like really just like I love like, with just like tears because I think
yeah.
she was been there, she was just, different things. And she was like, you've just been very like kind and things. But I just think the main thing is just like being able to provide compassionate care at their most vulnerable time, being a
Yeah.
calm, friendly, nice face, not like non-judgmental, and
Hmm.
they care. I think that's my favorite thing. Um, because if you, like, God forbid, if any of us ever got admitted to a hospital, we would want someone to care for us with a smile on their face, with care, like,
Exactly.
so I really try to,
Exactly.
as busy as it gets, I really try to, reciprocate that. So I would say
Mhm.
just being able to kind of be their angel, no pun intended.
I know, I got you. I know.
Yeah.
That's a good one. Your
Yeah.
mother gave you the right name. How's that?
That's a, we thank God. Yes.
God, oh.
Yes, yes.
Okay. And what are some challenges you would say you faced or it can face in your profession?
Yeah, challenges, I would say multitasking. It could be very hard, especially say I have like 5 patients. One patient maybe is on like a PCA pump that wants like a bolus dose. I have another patient who, let's say, wants to go to the restroom, but she has a left below the knee amputation and she wants like 2 people to help assist her sit her in the
Mhm.
bottle. I have another patient who is MPO that's screaming that they want food, they want food. They're like screaming, like throwing things like that.
Mm.
No matter how many times you explain it, patients don't like being MPO, as we all know. But
Oh, I wouldn't either.
right, exactly.
Food.
Exactly. And then,
Yeah.
yeah, and you're trying to like notify the provider. Let's say you have another patient that wants to walk now. Like they want to walk right now.
Mm.
Wait. Um, there's also, yeah, so there's also like another patient who's vomiting. Like these things literally happen all at the same time. And that's why
Mm.
it teaches you like priority, who is more, critical, like who do I go see first. So I would say
Right.
multitasking is the biggest thing. Like you really just have so many, especially like medical surgical floors, actually every floor. I'm not going to even especially every floor, every profession, let me not even do that. But yeah,
Mhm.
so it gets really, really busy and you have to really multitask and know priorities. So I would say multitasking is a challenge.
Mhm.
Sometimes um I would also say like there's different personalities. Like everybody who comes into the hospital has a different personality.
Mhm.
So you have to kind of like manage and navigate that. Some people are pretty OCD. They don't want you to touch like their bedside table. They don't want you to do this. They don't want you to do that. There's some patients who, may just, not really want your care. They may like refuse things. They may do this.
Mhm.
Other patients, sometimes few, but still there, that are very friendly. um,
Yeah.
but
Yeah.
the most part, they're all still like human beings which deserve to be treated with respect. So,
Yeah.
but I would still
Mhm.
say the main thing is like the multitasking is like the biggest challenge and knowing what is priority.
Priority. Especially inpatient.
Yes.
Yeah, yeah,
Yes.
yeah.
Oh no.
I've
Yep.
always worked outpatient, and I don't know if I'll ever work full time inpatient. In the next few weeks, I'll start covering some inpatient for our practice. So I look
Okay.
forward to that.
Good. Okay.
But
Okay.
I don't know if I'm made for the inpatient, but I think part of it is also because I didn't have much experience in the inpatient setting before getting my license. So I think that's part of it, is that I'm just like, I'm gonna stay out here.
Yeah.
I'm gonna
Uh-huh.
prevent them from getting
Yeah.
to the hospital.
Yep. Yeah. Yeah, that's
Um, but
definitely.
no, that's really good point, because I mean, you being the center of their care, right? Being the face they probably see most,
Yes.
especially in patient. It is very important to navigate all of that and figure it out. And sometimes you may miss, but human too.
Oh, exactly. That's really true. And like
Yeah.
also one thing I meant to mention too, like when about the challenge, like there's also a thing I kind of noticed. I think like there's probably some term about this, but I don't know if it's just like when you see somebody so frequently, like sometimes
Mm-hmm.
you get irritated. So it's a thing of like being the nurse, sometimes like patients really let out their frustrations on you. Like they really
Mm-hmm.
just get out,
Mm-hmm.
they really just have these things. But then if maybe like a provider comes in who's not really there that often, they'll be like, oh, hi, like, thank you so much. And then like when the nurse comes back in, they're like, okay, so, and I think it's just a thing of like always being around, like they feel like they can, maybe if they feel comfortable with you, that they could just be themselves. But it's this thing of like always like kind of taking on like, sometimes I guess it depends who it is, but sometimes taking on patients like grievances in a way instead of
Uh-huh.
like
Mm-hmm.
their attitude. And I think that may just be due to like them like seeing us so frequently, like in our face.
Mm-hmm.
Anybody else from any other specialty department, whatever comes in, they're kind of like nicer sometimes. And then other times when they kind of like see you frequently. I don't know. There's probably some
Yeah.
perks that
There's
side.
the phenomenon that patients can definitely tell a nurse or MA one thing and tell a provider
Yes,
something totally
yes,
different.
yes.
It's no joke, it's not a lie,
That's not a
it's
lie.
so true.
Yep.
And I couldn't think of it until like I studied my clinicals as a PA, and I was like, wait, what? Like people sometimes they would tell me one thing as a student PA, and then tell my preceptor something else, and I'm like, bro,
I know, like, yeah. So
yeah. So I can't imagine, it's like if that's outpatient, but then inpatient where you're doing everything for them, and they
mhm.
see a new face and the story changes or the
Yes,
attitude changes. Yeah.
yes,
Yeah, I can see that.
yeah.
Um, Now, what was the reason for you to decide to become a you see
Should I become but maybe I should become like a PA, huh? Maybe at this point, right? I mean, it's super
where at this
fun.
point,
Yeah.
why did you decide to become a nurse, Angel?
So, for me, I feel like I've always enjoyed. I know this like I feel like everyone says this, but I know I've just
That's why you're in the
yeah,
profession.
yeah. I genuinely have always like enjoyed like helping people, and I do think I am a pretty like patient person. Like, and I feel like I do enjoy seeing people get better and just get to the best version of themselves. And I love just kind of nursing people back to like hopefully like their normal state of health again. And I think
Mm-hmm.
like nursing is the best way. I also love to like educate, you know. So I feel like nursing is a perfect mix of all of them. It's compassion, it's patient education, um, it's like all these things. So I just decided to become a nurse because I have always like loved helping people in any type of capacity. Uh,
Mm-hmm.
I really just want to see people again get to the best version of themselves healthcare wise. So
Mm-hmm.
I think that's why I chose nursing.
Okay.
Yeah.
All right. How is your work-life balance?
To me, it's actually pretty great.
Yeah.
Um, yeah. So okay, well, yeah, okay, yeah, it is. Sorry, I was like,
Hold on.
I
Let
was
me
like,
not lie out here.
yeah, wait, yeah, okay, yeah, okay, yeah, it's good. So, so yeah, I do just because like when I'm off, like I really enjoy myself. Like I'll, hang out with loved ones, like family, friends, like my significant other. And then I, de-stress with like reality TV. Like
Mm-hmm.
I like to dance on the side. I like to cook. I like to go out to things like on my days off. Maybe I'll have like a day to just relax at home,
Mm-hmm.
do things like that. But on the other few days I have off, I'm definitely like, doing something. I'm with like a friend. I'm maybe at a coffee shop. I'm
Mm-hmm.
maybe going to an amusement park, going to
Mm-hmm.
some events. Yeah, so on my days off, I definitely feel like I do things and that helps me have a good work-life balance because I'm also
Right.
in the hospital, but then once I'm out, I am enjoying myself in my life. And you have to,
Mm-hmm.
self-care.
You do. You really do. I think more and more of us healthcare professionals are realizing that being being a helper doesn't mean you can help yourself. Being a caregiver doesn't mean you have to put yourself on the back end, right?
Exactly.
Yeah,
Exactly.
yeah. I was very guilty of that, and I was like, you know what? Maybe this year is the first year of like my American career, to be honest. That I only have one job. Like I have one job. That's it. And I can't tell you how tempted I am to get a part-time job. I can tell you that I am very tempted. But I'm like, you know what? I'm in school. I had a husband to love on. I have a house to keep. I have gardening that I want to do for fun, family to keep up with. So I'm just like, there's plenty more to do besides finding another job. I'm good.
That is amazing. Yes. Yes, you better get to self-care and yes. Yes.
Yes, yes, yes. Now, what would you recommend, or what would be some advice you would give for somebody who's thinking about becoming a nurse, especially an RN?
Yeah. So one kind of thing I would say is like make sure your heart is in it because sometimes people come into the profession and then they just feel like, I'm in here for the money, like I don't really care about whatever else is going on, like, like whatever, and they just kind of go about their day. And I feel like that could be very dangerous because when you go
Mhm.
into a profession and you don't really have any empathy or care or compassion, it kind of,
Mhm.
it's a little scary. Like I wouldn't want someone, taking care of me and then they're just like, hi, my name is this, like what, whatever, I would want someone to kind of be like that friendly face. So I would say one, make sure your heart is in it. Um, Two, I would say to do your research, like do you just want to do like straight RN route, straight RN route? Would you want to do like RN BSN, like BSN route? Do you have a bachelor? Do you want to do MSN? So kind of do your research and see what you would like to do. And then lastly, like just make sure that when you do get into nursing school, to make sure to study hard, because
Mhm.
it's going to be several exams, select all that apply, all these questions that have answers and all the answers look the same, so it's like,
Don't we love those?
yeah, don't we love those? Yes.
Mhm.
I would say I would recommend those three things. Yeah, make sure
Mhm.
you're study hard. Um, and yeah, those are the main pieces of advice I would give to kind
Okay.
of.
Okay. As far as any future plans for you, I know you are joining an adjunct faculty.
Yeah.
Are you currently doing that now, or is that something that's upcoming?
Yeah, so upcoming in like the coming weeks, but I've already I'm like onboarded and everything and stuff like that. But
Okay.
I'll be, yeah, start in a couple of weeks. Yeah.
That's exciting. Are you looking forward to it?
I am, yeah. I've always wanted to teach. So I'm looking forward
Mm-hmm.
to like kind of getting this journey going. Like I just think it's such a beautiful blessing to kind of be able to have like, little baby nurses and kind of like help, train them. Although, I'm still kind of a baby nurse in some eyes. I've been a nurse almost 3 years, but I
Mm-hmm.
I've always known I wanted to teach. So
Mm-hmm.
I want to go straight into that. So yeah.
That's amazing. That's amazing. Well, I am excited for your teaching journey, and you balancing that with clinical. Um, one of my professors I had in PA school was I think a couple of them were clinicians as well, especially the ones that brought out to teach the special modules like the Medicaid, the hardcore clinical modules where most of them were clinicians as well as, adjunct faculties. And I think having the clinical background that are current really help their teaching, and help us understand the material better, I feel
Yeah.
like.
Agree.
So
That
I'm
makes
looking forward to that, for your students, and I'm sure you'll be a great teacher.
you.
You're
You're amazing.
welcome. Anything else you would like to share before we end this beautiful conversation?
Well, yeah, I just want to thank you. You're doing amazing things with this wonderful, podcast and everything that you're doing. You're definitely
Thank you.
inspiring others. And I really, just want to say that I think you're doing a great job. And I do thank you for, having me on here. And I think that you are inspiring everyone, including myself. So thank you.
Thank you.
Yeah.
And like I said, I was telling you before we started recording, if any of your colleagues, RN, LVN, whomever wants to join, let them know. I'm open to, especially if they're in different specialties. What
Okay.
I try to do is highlight as many specialties as possible when I'm talking about a profession, so that, the listeners may, sort of get a broader idea of the profession.
Yeah.
But no, thank you so much for sacrificing like an hour of your Sunday. And I know I was like bugging you even before this, asking you for X, Y, and Z. So I
Oh,
appreciate your patience for that.
of course. You're so very welcome. It's been a pleasure, honestly. Yeah.
All right, Angel. Well, very nice meeting you, and have a beautiful upcoming week.
Thank you. You too.
Thank you. Bye. Alright, audience, that is all I have for you today. I hope you all enjoyed this episode. If this is your first time here, a warm welcome. And if you're a returning listener, I appreciate you coming back. Please make sure to like, subscribe, share, comment, and connect on all social media. Till next time, ciao!